Thank you very much. Thank you to David for organizing this beautiful meeting, and my heart with the families. It's an honor and privilege to work for you and with you. So I'm sorry for the slide. Something wrong happened with the conversion, I think. I'm going to address two things in this presentation, which is a little bit redundant with what have already been said by several speakers today. I will talk about estimating the lifetime and age-dependent risk of cancer in carrier of germline mutations. And I will also talk about new approaches to distinguish between severe and mild mutants, which is a sort of classification of mutants which is based on their transactivation activity. One of the messages of my talk is that I think that we have to pay a lot of attention in Li-Fraumeni to what we don't see. Not only we are trying to see things and make them objective and document them, but there are many things in Li-Fraumeni that we do not see because they are not there. And watching these things that are not there actually is teaching a lot of lessons. And that will come back in several points of my talk. P53 plays many roles during life, and this has been very well documented now, including by brilliant work by several members of this audience here, who have shown that P53 is important from preconception stage, plays a role in the pre-implantation of embryo, and then plays an important role in the control of embryonic stem cells, also in development, in adult cells and tissues, in post-mitotic adult cells, and then it also controls senescence and gets also involved in terminal aging. This means that there is a sort of trajectory of activity of P53 throughout life. And yet, it's not necessary for any of these actions, because we know that mice, for example, that are devoid of P53 still go through all these steps almost normally. They have a number of problems, including the fact that they have a high risk of early cancers. But it's not indispensable for doing all these actions. So the concept is that P53 is finely regulated in terms of activity, and that, to make it simple, if you have too little of P53, you're at risk of early cancer, because you have increased a lax control over the normal dynamics of stem cells. Maybe they get more genetically unstable. Maybe there is undue expansions of pools of stem cells that are at risk for developing cancer, and you are at risk of getting early cancer. And if you have too much P53, it can push your cells in early senescence, and even in extreme case induce a phenotype of premature aging. But in most people's lives, what it would do is to hamper tissue maintenance and surveillance, and it would increase a lot of inflammation. And this, at the end, also can lead to some form of cancers, including the cancers that we see in late life in in large part of the general population. So I'm going to put this into perspective, into trying to interpret what we can say about the risk of developing cancer over the whole course of lifetime in a P53 mutation carrier. And the data I'm using for this is data from the IARC P53 database that we started to put together as the germline part of the database in 1995 or 96. And which is maintained now by my colleague Magali Olivier, who is doing that work since almost 20 years. And she has accumulated a data set of P53 mutations and families that was described in published literature. So it's a public data set, which is entirely anonymous, and which can be used by anyone. And of course, it's largely used to try to document the Li-Fraumeni syndrome. The dataset I'm using, in the dataset I have removed the mutations from the Brazilian families because they are a bit special, as you have heard on several presentations today. So the data contains about 2,000 individuals and about 775 families who correspond to several definitions of the Li-Fraumeni syndrome. This is my sort of general picture to represent the Li-Fraumeni syndrome, which is actually a disease that can be characterized by 3 different phases. A childhood phase with 4 signature diagnoses. This is what I call the Li-Fraumeni quartet: choroid plexus carcinoma, adrenal cortical carcinoma, embryonic rhabdomyosarcoma, and medulloblastoma, all occurring before the age of 10, essentially. And then there is a second phase, which I call the adult phase, that goes mostly from 15 to 50 years, and which is characterized by a succession of a number of diagnoses, essentially different forms of sarcoma, different forms of brain tumors, breast cancers, and at the, I would say, terminal late part of this adult phase, a slightly increased risk of early colorectal cancer and early lung cancer. And then there is, I would say, post-50 years phase, later adult phase, which is in fact characterized by no particular diagnosis. There is no specific Li-Fraumeni diagnosis that falls within that particular window of time. And yet, this is the time of life where in the general population you see the largest numbers of cancers. And so, as I explained, in the P53 database, the most represented mutation in terms of number of families is the Brazilian 337 mutations. And the data I have analyzed corresponds to the other mutations that are found in the mutations that are typically of those found in Li-Fraumeni families everywhere across the world. The overall penetrance of the syndrome is near complete. As you have seen in several presentations, it's about 80% over lifetime, a little bit higher in women than in men. But in early life, it's the contrary. Tumors accrue a little bit more in men, in boys, and then in young men than in young women. And then I would say, the prevalence increases in women essentially around the age of 30, 40 because of the weight of breast cancer. Now, this complex slide with a big table here shows actually the calculations we made to estimate the percentage of risk to develop different types of cancer based on this IARC-P53 data set. And just to highlight the main point, here this colored figure here showed you the excess risk over lifetime of developing different cancers. The biggest excess risk is for adrenal cortical carcinoma, with an excess risk which is almost 300 times. For osteosarcoma, it's in the range of 80 times. For soft tissue sarcoma, 40 times. Brain tumors, about 20 times. Breast cancer, about 4 times. Right? So there is a much significantly increased risk compared to the general population over the entire course of lifetime. For a number of other cancers that we also see in Li-Fraumeni families, the risk is not significantly increased over lifetime. For example, lung cancer, colorectal cancer, ovarian cancer, not really strongly increased. What happens is that they tend to occur earlier than in the general population, but the overall risk over lifetime is about the same. And for some cancers, such as, for example, prostate cancer, from the data we have, the risk seems to be lower, maybe up to 4 times lower than in the general population. Now, looking at by age group, the risk of developing cancer is very high in the early years of life. It's in the range of about 10 to 15% in the first 10 years, a little bit less during the teenage, and then again high in the age group 20 to 30 and 30 to 39. And then it starts to decrease. And it decreases to relatively low level with advancing age. Yet in the general population, we see exactly the contrary effect. That is, the risk of cancer increases with age. It's relatively low until the age of 30, and then it progressively increases and it peaks up in elderly, in aging adults. That means that at some point about the age of 50 years, the curve of the risk for Li-Fraumeni and the curve of the risk for the general population cross each other. And if we make a ratio of this risk, we will see that the excess risk for developing cancer in mutation carrier is in almost 100 times in the first 10 to 20 years of life, and then decreases to be identical or equal to the risk of the general population at about 50 years, and then seems to go even below this after the age of 50 years. And what is really spectacular, again, is what we do not see, because there are a number of things, of cancers, that are very frequent in the general population in that age group, which are rare in mutation carriers. Liver cancer, head and neck cancer, cancer of the cervix, squamous cell carcinoma and small cell carcinoma of the lung, just to name these 5 cancers which are relatively common, as well as a number of cancers linked with inflammatory conditions such as esophageal cancers or even the colorectal cancers that develop on inflammatory mucosa. These cancers, which are really the main burden of adult cancer in the general population, are rarely seen in mutation carriers. Now, one way to look at this is to use this quite provocative model that has been developed now about 2 years ago by Tomasetti and Vogelstein, who have proposed that the frequency, the risk of developing cancer in specific organs was proportional to the number of stem cell divisions that may occur over lifetime in this organ. So they have estimated the number of stem cell divisions that can occur in different organs, different tissues over lifetime. And they have computed it against the risk, the lifetime risk of cancer estimated from epidemiology databases. And so most cancers actually fall on this nice straight line, with some cancers having an estimated low number of stem cell division and a relatively low frequency of cancers, and some other tissues having an estimated high number of stem cell divisions and a population risk, a high population risk of cancer. Now, there is a very big paradox in the prevalence of these cancers and in their relationship with p53 mutations. In fact, the tumors in which we have often germline associated with germline mutation carriers are all in the group of tissues that are predicted to have relatively low stem cell division, number of stem cell divisions. Whereas when we see somatic mutations in cancer, they are more frequently in the tumors that are at the other extreme of the spectrum. And there is very little overlap between the two groups. That is, the tumors that develop in patients who have a germline mutations are not the same cancers that occur with a somatic p53 mutation. It behaves, the risk of cancer seems to be as if the absence of p53 would actually increase the number of stem cell divisions in these tissues and therefore increase their risk. So this leads me to suggest that actually p53 can get involved in carcinogenesis in two different ways. One way is the way which is actually explaining a lot of the risk in Li-Fraumeni. The lack of control by p53 over stem cell dynamics may lead to expansion of excessive pools of stem cells, and within these stem cells, increased change that they will acquire further events that would lead to cancer. And the other mechanism, which is presented here, concerns adult differentiated tissues submitted throughout life to many injuries, mutagens, viruses, metabolic disturbances, inflammatory conditions. And all these conditions will impact on the maintenance and survival of the cells in these tissues, in particular by mobilizing p53 that may push these cells into induced senescence, in particular in the face of extended inflammatory stress. And tissues react to this by compensatory proliferation, and in this context, acquisition of a somatic p53 mutant becomes a selective advantage for cells to develop a cancer. This means, in other terms, that losing p53 at this step becomes a sort of necessary conditions for these cancers to develop. And what I'm suggesting is that this pathway of carcinogenesis is actually because of haploinsufficiency of p53 in p53 mutation carriers. This pathway of carcinogenesis doesn't operate as well, I would say, as in the general population, and therefore, subject who are carriers of this mutation are at less risk of developing cancers, this cancer in late age than the general population. Now, in my second part of my presentation, I will switch to trying to distinguish between different p53 variants, and the dataset I'm using here is a dataset, absolutely fantastic dataset, developed by Shikashi Ishioka about 15 years ago. What Ishioka did is to express all possible p53 mutants, not only those that exist, but all theoretically possible. They engineered every mutant at every position of the protein, a total of 2,600 mutants. And they placed them in a standardized system, which is a yeast, equipped with 8 different reporters for p53, and they score the activity of each mutant towards each promoters. And that data set has been used by many people, essentially, including us. We've tried to separate these mutants that retain transcriptional activity a lot, a little, or have lost it, and make different functional groups on this basis. Here we have worked on a completely different hypothesis, which is a sort of intuition of similarity. We know, we're working on p53 since quite a long time. Everybody in the field knows that the protein is extremely labile in terms of conformation. It can change shape depending on biochemical conditions, depending upon temperature and so on. And this is, I think, why all these prediction models for impact of mutation based on purely structural consideration are not satisfactory. Here, what we've been thinking about is that These 8 reporters to which p53 can bind with different ways are in fact like 8 different lights of beam on the DNA binding surface of p53. And by looking at the shadows of this beam, by looking at the similarity of the way the mutant bind to the structure, we could find clusters that separate different types of mutations. So we've devised a system of iterative clustering, first to separate in 2 big clusters, which are shown here, and then further clustering these clusters in subgroups to end up with a classification here that distinguish what we call a class 1, with the most severe class being what we call the triple 1 here, and a less severe, which is the class 113. And then different classes and clusters, including this cluster here and this cluster there. These are the most represented clusters. The others are very small. And they actually map beautifully all over protein structure. I remind you that they haven't been selected for their position or for whether they are hotspot or whatever. It is just a sort of global agnostic clustering. And here you can see that the 2 most severe classes separate mutant in the distal and the proximal part of the DNA binding domain. Whereas, for example, this class here contains mutants that are in the N-C terminal domain and mutants that have relatively little impact on the protein. And this class here corresponds at the tail end of the DNA binding domain and a little bit of mutants in the N-terminus, whereas that class here corresponds to really the distal C-terminus, as well as some mutants in the DNA binding domain. This is not something that we could have predicted by any of our predetermined knowledge about p53 structure and function. It makes sense. We can interpret some of it, but it's not something that is intuitive based on our previous knowledge. Now, this is where the different, how the different clusters are affected by mutations leading to Li-Fraumeni. Most of the mutations leading to Li-Fraumeni are in the triple 1 clusters, including all the hotspots, and a number of other mutations, about 30% of other mutations, are distributed in other clusters. What does it mean in terms of penetrance? It separates mutants in categories with about 20 years difference at 50% penetrance and about 35% difference in the penetrance at 30 years between the less severe and the most severe class. So just to go quickly through these classes, this black line here is null p53 mutation, so those predicted to destroy the protein structure. The most severe categories are the triple 1, the red one, and this category here we call 113, and they correspond actually to these 2 groups, that group and that group. The triple 1 are here, and the 113 is there. And they are very similar in early age, until the age of about 10, and then this one decreases and goes beyond null mutation, and this one is consistently identical or even a little bit more penetrant than null mutation. A second group are 2 groups of mutations that have lesser penetrance than null mutations, so they retain partial p53 activity, and they correspond to this group of mutation, here the blue line, as well as mutations that are present both in the N and C terminus. And the third group is very special because it starts with a small number of early childhood cancer, then very little tumor accrual during adolescence and early adulthood, and then tumor starts to increase again by the age of 30. The Brazilian mutant actually belongs to that particular group, and it has that particular profile. Another point is that when you look at what happened in early childhood, the classes also separate types of profile that corresponds to different pathologies within Li-Fraumeni. For example, the triple 1 cluster is really the best representative of severe Li-Fraumeni, with the presence of adrenal cortical carcinoma, of choroid plexus, rhabdomyosarcoma, and medulloblastoma. So the quatuor of Li-Fraumeni, the signature quatuor, is present in that cluster, and it is the only cluster that has these 4, the quartet signature. Whereas the other cluster, this one here, is characterized almost exclusively by having the highest load of adrenal cortical carcinoma and little of the other tumors of the quatuor. So it separates two different profiles of developing tumors associated with the early part of the Li-Fraumeni syndrome. And to finish with, I would like to show the distribution of these different mutations in different sets. This is the repartition of the cluster among the 2,600 mutations, so completely unselected. As you can see, the main cluster is this 2-2 cluster, followed by the cluster 1-3, and then the cluster 1-1. This is how these clusters are represented in Li-Fraumeni. The cluster 1-1 is by far the dominant one, 70% of all mutations. It shows that it is clearly selected in Li-Fraumeni. And this cluster is a little bit, is the second most prevalent. It's also a cluster of mutations that have an effect less severe, but still very much associated, including with early cancer. Together, these two represent about 80% of all Li-Fraumeni mutations. Other clusters are underrepresented. Now, if you go to the NOMAT dataset, you find the sort of reverse complementary picture. So this is the dataset of 130,000 sequences from, I would say, quote, general population and selected from cancer. And you can see that in this dataset, the two categories that are most prevalent in Li-Fraumeni are completely underrepresented. They represent only 6%. They are present. These are hotspot p53 mutations for part of them, but they are a small group. And the group which is the most prevalent, 94%, are the mutations corresponding to the less penetrant categories, and even their proportion between the different categories is almost the same than in the non-selected dataset, which means that most of these mutations are just occurring and they are sitting there. In some instances, they can lead to Li-Fraumeni, but in many instances, they may not lead to Li-Fraumeni. So my sort of conclusion figure would be to say that with Li-Fraumeni, we are clearly facing an iceberg. The top of the iceberg is the penetrant form of Li-Fraumeni, which is, I might say, the 111 mutants, with some of the 1-3 category, which is just at the interface between the two. And then we have a large iceberg of variant p53 that is present in the population. And this variant p53 may correspond to a form of what I would call M-LFS, the masked LFS. And the masked LFS is a form of the syndrome that needs something else to be activated. That's probably what we see with the Brazilian mutant, and it was beautifully illustrated in the talk of Jerry Dambetti yesterday, who suggested that association with another variant on a gene nearby would be very important for the mutant to express its potential as a potentially mutant leading to Li-Fraumeni. So depending upon condition, conditionally, this mutant may express either a severe or no phenotype or a benign phenotype. And the factors that can play a role there are genetic modifiers, immunity, metabolism, environment. Many factors may be affected. So the question we have is to try to understand what makes the Li-Fraumeni window. With the powerful mutant, the iron fist mutant like the 111, the window is constantly open, and very few modifiers have an impact. And this is why you find this mutant in every population in the world with almost the same pattern of cancer. If you go, there is a beautiful poster from colleagues from Japan here who show that they have exactly the same pattern of tumors with the same age of occurrence, depending different genotype and different types of cancers associated with ethnicity-related polymorphism. We find exactly the same pattern. So these mutants have such a strong, this is why I call them iron fist mutant. And then other mutants, like the masked mutant, they need something else to open the window. And what concurs to open the window is probably modifiers as well as co-occurrence of other mutations, cancer-causing mutations, changes in metabolism, and we have heard about that in the talk of Patricia. I'm sure we will hear Paul Wang tomorrow talking also about the major impact of metabolism in Li-Fraumeni. And the third factor to consider, and we will hear about that too, is the role of immune response. So I will finish here. Lifetime trajectory of p53 activity is important. Li-Fraumeni is teaching us very important lessons. Not only we can understand, try to use this to understand better what's happening in Li-Fraumeni, but what is absolutely fantastic is that Li-Fraumeni is teaching us and telling us a lot of things about what is maintaining of healthy trajectory of p53 throughout life. And there is a lot of lessons to learn about how cancer arises by trying to understand what's happening to mutation carriers who do not develop cancer as they progress through life. So thank you very much for your attention. I would like to thank Amina Amadou, who is doing the epidemiology work on p53 mutation, and Nathanael, who did the clustering, and then Magali for the database, Shikashi Ishioka for the yeast data, and my collaborators, including Chang Chang, Arnie Levin, Annie Arifin, Li-Fraumeni at Kuala Lumpur, Maria Isabel, Patricia Prola, and of course, patients and families. Thank you very much.
Thank you, Pierre. It's 5:32, but we start 7 minutes after 4, so we have time for one question. Pierre.
Pierre, very nice. The one intriguing thing is obviously your life curve showing a reduced risk after the age of 60. The one question I have is that the risk of first cancer? Or is it, if you include people who've already got cancer, they tend to get more and more. So is that the risk of first cancer, in which case those individuals that haven't got it by that age might be very protected by other factors that they have?
Yeah, it is the risk of first cancer. Yeah.
A very nice talk. So the clustering, what is the information that you use to perform the clustering? To the survival outcome, were they used?
What we did.
The clustering of variants. Yeah.
Well, this is a complex thing. What we did actually is to represent the database we have on Li-Fraumeni, and we have tried to map them onto a population structure. That is, essentially, we have censored subjects at the time when they develop a cancer diagnosis, and we have considered the time to diagnosis as consecutive follow-up year to create a population that has overall approximately 75,000 person-years of follow-up. And then we have mapped the incidence on this population and compared them to incidence in the SEER population.
So potentially, since it's clustering, and then would it be if you merge some of the clusters that are closest to each other, would you obtain more distinct penetrance curves?
Yeah, I'm sure that there is a little, but I mean, I think that with the clustering we have done, we have gone as far as we could go with that logic of clustering. And I'm quite, I think that it shows things that we haven't seen before and which are stronger than any of the other classifications, and I've played with many of them. That's the best we've had so far. But I think we can go a bit further. And one of the things that would really be interesting, and we are working on, is to use the ratio between the expected number of mutations that you would expect at a specific site and the observed mutation. That would give you another index of a possible biological selection of mutants, and use it as a second layer criteria to try to scoop out within each of the clusters the mutations that are the most likely to be selected in cancer.